Finally, I check the closure lightly, so there can see some swelling, so I can remove a bit the tooth picker, and so clean lightly. So I think close your eye, please. Okay, yeah. So now I finished this patient first treat because her skin is thin. So if I treat it too much, it will make some irregular. So I told her two times or three times is necessary. But I think her asymmetry is improved very well. So about 7 days later, I can find the effect of this correction of the asymmetry. So, but when I will explain more, close your eye, because I would like to roll down the medial portion of the right double fold. I treated the immediately below the original line. So, and after then, like outside, I would like to upping of the double fold. So I treated the upper portion, and left side, I think the skin sagging is a little, so I treated the high portion of the original surgical line. So it is necessary for treating case by case, and so if you would like to reducing the portion, treat the below the portion and the upping the upper portion. So that's all. So that's the technique for correction of the asymmetry of the eye. So which is this is another form of the hypertrophic scar. So when treating the hypertrophic scar, the most important part is that not digging inside of the skin. So a little bit flat is okay because the Plexr will make some contraction. So after that, it will be making the flattening. But if you treat too much and too bigger, and it will depression of the skin. So, but you don't worry if you make any depression, and after that you will treat the outside of the depression. So it will make some protrusion. So yeah. More closely, please. Okay. This is a little bit protrusion, so I will not treat very aggressively, but I will show the treatment. Dry one, please. Dry bud, please. Dry bud. If there is some water in the gauze and boric acid, it will reduce the energy of the plexus. So if there is some tearing of the patient, and it will make the less energy. So you should remove the water. So first three, I treat the. Do you have any pain?
Slight.
So I called this one layer by layer technique. So I like peeling the apple or some fruit. You should not treat the deep inside, and after that I remove the proportion. So it will decrease layer by layer. So dry one, please. Dry gauze, please. Not the cotton ball. Yeah. And you can find the dimpling and the crust over here. So after that, I put the ground like this and like this. A little bit pain. Okay. So when the patient feel pain, more pain. So you should you can treat very quickly. So it will be less pain. Can you feel the flat? Okay. So I think this is white tissue scar. So when you're treating the patient with the facelift surgery, modified facial lift incision, and there is some scar, white scar, you can treat the Plexr with the white tissue scar. So because it's very different. So the whitening will be changed layer little by little. So when treating the reddish scar, the skin color is changed to a little bit reddish because time is gone. So you can get this. After removing the scar, you can check the flattening of the skin. So, and you don't worry about the skin color change because her skin is not white like the Caucasian. So it will change the time by time. So about I think about 7 or 8 days later, it will be more brown. And if you have some depression, but I don't think it will make any depression, but you can feel the flattening over here. So can you feel? Yeah. Okay. So I think this is more flattened. So after that, the skin color is the problem. So you should not say your patient that your skin is different from here to here because it will change the time by time. So you don't worry. So it will not be continue to be this color. So it will change time by time, but it's case by case. But I think the most long difference of the skin color is about 2 or 3 months. But after that, she is very satisfied with the result because now her color is almost the same. So that's all. Yeah. But when treating the scar, but if you treat it more, and you will make some dimpling and make some depression, and it will make some very complaint of the patient. So patient will talk to me because I don't want the depression, but yeah, so I think a little bit of protrusion is okay. So because it will depress him. So that's all.
This is a hypertrophic scar. Does it work also on those keloid scars?
Keloid is the same, but when reddish keloid, red keloid and B keloid, when you should not treat too much, like white one. Because white one is very resistant for depression, and you can treat almost flattening. But when reddish keloid and it is contraction, it makes some contraction better than the white tissue scar. So you must not cut almost flat, a little bit protrusion, and then it will make more contraction. But I think the color change. Some patients the color is changed to the almost the normal color, but some patients the redness will lasting because it's the type of skin. So I think I already talked to my patients that when the reddish keloid, you should not anticipating for the almost normalizing of her skin because it will make some skin difference. So
does the keloid regrow again after you move it for those that are ready?
No regrowth, a little bit comparing with the other treatment.
How many sessions will you split it over?
Just layer by layer. So if the keloid is very big, you treat. Yeah.
Still one section?
No. when treating it's the case by case, but I think when treating the scar, I already recommend my patient about 5 sessions. It will be necessary, but if the patient response is the first session is finished, yeah. So, but for protection for doctors, so you already recommend the patient. No average, on average 5 sessions, but if your response is 1 or 2, will be okay. But you should not tell the patient 1 session is okay because it will make some complaints. So that's what I mean. Compared with other procedures, plasma energy is very good because it's very superficial and no thermal damage and no any other complaints. So that's yeah. Sagging and hooding of the hooding of the double fold line. So I will uplifting of the fold like here. So but I think his skin is a little bit thick, so I will check the skin thickness and design the region. So open your eye, please. So I will treat like this. Close your eye, please. So firstly I check. I will lift his double fold from medial portion for 1.1 millimeter and to lateral portion I will treat 2 millimeter lifting. So I will treat it. That's what I will try now. Okay, a little bit pain. You okay?
Yeah.
Less pain. No pain. Almost done. So 2 minutes. Cotton. Eyeball. Cotton ball, please. Yeah. Open your eye, please. Yeah. Here. Okay. I will treat 1 minute.
Okay.
Yeah, last 1 minute. So. Last one. Please. So I think I treated him with the very close your eye, yeah, right area, but he is a little bit painful for sensation. But when you try to Dr. Nicholas, yeah. So you should treat much more to a proportion. So I think he about 7 days later, he will look more natural and more wide open. So but that type. So but now I will not treat much more because then I will check the amount. So mirror print, yes. Yeah. So I think you will know the exact amount of the here. So I will get like a little bit. So but I think you have some frontalis muscle down is another portion. So it is necessary for lifting another. So if the patient like Dr. Nicholas or if have some frontalis problem, so another lifting technique is good for lifting of the GMB company has another facelift device, and so if you treat the patient with the Plexr and another device, it will be more synergistic effect. So it's my last case. So thank you very much for attention. Yeah. So he has some lentigo. Yeah.
Okay.
So I will treat to the last one, but it's very easy. Yeah, so I think male patient we need
Actually, the eye was okay. It's only the last part.
I'm sorry. Yeah. So airflow is that's also treating. I am also less sensitive than female patient. My wife. So my wife is very. Dry one, please. Dry gauze, please. Just using the Plexr to the protruded region and not digging inside the skin because it will make some problems. So you check here. So we superficially remove and after some not remove the portion, and after then you treat with Plexr. So about two sessions, but I think this is not Lentigo, this has some loosening over here. So yeah.
So for this SK here.
Yeah, so but not the usual red SK. It's not removed clearly. So and second time we treat. So but I think it has some root inside this. Yeah.
Actually, the treatment wasn't painful. It was only towards the end.
At the end,
the
yeah,
upper
so,
part
yeah,
was
so.
quite stinging, but otherwise it was
Yeah, right. So, but mostly it's okay. So and I will show you the brief method of the wrinkle treatment. So if he has some very tiny wrinkle like here, no Emma. So just I will not treat. Okay, just can you imagine? Yeah, just one, two, this one, two layer. So fine wrinkle, and if the wrinkle is deep like this, treat it like this one, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3. And the wrinkle is very wide, so then treat this area like here, wide area, 1, 2, 3, 1, 2, 3, 1, 2, 3, and the wrinkle is deep. Make the third row, and 1, 2, 3, 1, 2, 3, 1, 2, 3, and third row.
so you basically stretching the
Stretching, yeah. And so this Plexr has some effect of the contraction. So we are using the. I think very okay. No problem.
Thank you.
Thank you.
Samida.
Do you have any question?